Hola, Daria. Buenos días.
Buenos días, Pablo. Buenos días.
Buenos dias. Welcome, everybody. Welcome, everyone. On behalf of the World Organization of United Cities and Local Governments, Metropolis and UN Habitat, in collaboration with Public Services International, we welcome you to this thematic session on local public service, keeping frontline workers safe. Colleagues, before yielding the floor to our Secretary General, I will go to some technical
Translation, please.
session. Oui, monsieur. As you know, we have interpretation channels in English, Spanish, and French. We remind you to mute yourselves when not speaking. And when speaking, turn on your video, speak clearly and towards and near the microphone. We suggest that you select up here to see only the active speaker, to be able to see the slides. As usual, colleagues, we will have an online consultation. So we ask you to go to menti.com and use the code 860327. Colleagues, having said this, I now yield the floor to our Secretary General, Emilia Saiz, who will be chairing this session. Emilia, the floor is yours.
Hello, how are you, dear colleagues? Welcome once again to one of our live learning experiences. It's a great pleasure to have you with us. I am particularly delighted to have our colleagues from PSI joining us in this exciting exercise. This music that we put at the beginning it gives us kind of hope. And if you remember, can someone explain to the mayor of Ouagadougou how to do this? Please, team, just approach him directly. So I was saying that music is, you know, it's from the movie Forrest Gump, and Forrest Gump was saying, you all remember that life is like a box of chocolates. Well, the chocolate that we are having to digest for these last months is a very surprising one with a very special taste. Is one that is allowing us this new context to realize that how deep many of our gaps, of the fragilities that we had identified are embedded in our societies. And the topic that we're going to be dealing with today is particularly important, and I will share with you a frustration that I have in the international debate about how little we talk about public service delivery. Very little. I mean, we are talking about the sanitary needs. We are talking about all spheres of government, but actually local public service delivery, which is core to underpin the sanitary measures, and that is marking our day-to-day life everywhere, no matter our context, whether they are good or bad, whether they have a deficit or not. Whether they are well managed or not, they really define how we live, and we don't really talk about them. And we even talk less about the people behind those services, so the actual workers. And this is something that we very strongly feel needs to change. And in order to change that, we need this partnership between the workers' organization, the trade unions, and the local and regional governments. We need to make clear how important this service delivery is going to be for the aftermath of the pandemic, how critical our service delivery is being during the pandemic, but also how much in jeopardy the sustainability of this public service delivery can be after this. So this is why we decided to have this meeting together. We all know the situation of service delivery in the world. It is under-resourced, with not well-paid workers, with very little recognition for the critical role that they are playing. And very often, it is not in the picture of the recovery plans. Well, this time, it needs to be different. And that's what we are hoping that we can put together as recommendation after this session. We are working on a joint statement with PSI, but we really hope to hear from all of you on what are the critical steps and the critical asks that we need to do to the national governments, the international community, etc. We will also need to look at ourselves, and I am standing here before you as United Cities and local governments. You know, we are the work providers. This is what I represent. I mean, if there would be a union, UCLG would be that union for local and regional governments. And the relations between the workers and the work providers are not always easy. So this is not an easy conversation, oftentimes, but it is a very critical conversation. So I would like to stop here and open the floor to the excellent partners that we have to run us through their perspective of things. We really hope that we can, in the coming weeks and months, really build the international case together around our advocacy measures to ensure that what we have always said about local service provision within the context of the Sustainable Development Goals is now also taken into account in the post-COVID era. You will be hearing more from me along the session. But allow me now to just go to the other speakers of this opening session. And I would like to give the floor to Andre Dicus, Chief Urban Basic Service Section, Global Solution Division, and Urban Practices Branch of our partner, UN Habitat. The floor is yours.
Thank you very much, Emilia, for setting the scene, and also dear Rosa from PSI. It's very nice to see that PSI is involved in this event. And dear ladies and gentlemen, and of course, dear fellow workers, it's a great pleasure to be here today at this session, which is really, I think, focusing on a very important issue, which is the local public service workers. I'd also like to take this opportunity just to send the apologies and also to convey the best wishes from Maimuna Mohammed Sharif, the Executive Director of UN Habitat. She usually sits here at this juncture of this session, and she's actually very keenly following up on these sessions. So it's very unfortunate she can't join. From UN Habitat, of course, the perspective is that we feel that many of our most essential services are provided by public service workers. Urban basic services such as water, sanitation, solid waste management, and transport, we feel are the lifeblood of our urban systems, providing the underpinnings for an active and healthy life in our cities. These services are also critical in stopping the spread and lowering the impact of COVID-19. Behind them all of these services are the women and men workers who do their jobs every day out there. Central to efforts in ensuring continuity and also even extension of basic services where they're not available is the protection of workers. If they're not cared for, if they're not protected, incapacitated, these systems will fail. These workers are often neglected and taken for granted. We only notice them when the sewage overflows, transport comes to a halt, or waste starts to accumulate on our streets. And yet these workers are disproportionately exposed to the risk of infection in comparison with the general population. Many have already fallen ill, and some have lost their lives. For example, the New York's Department of Sanitation in April confirmed that they had 354 cases of COVID-19 amongst members of their workforce, and unfortunately 1 death. The option of working from home or stay at home does not exist for these frontline workers. In low and middle income countries, where waste collection and public transport services is largely informal, it is actually difficult to assess the impact of COVID-19 on public service workers. However, there are many factors that increase their risk, such as the lack of protective equipment, overcrowding in public transport, and poor waste supply and sanitation to ensure basic hygiene. Many workers live in overcrowded conditions in slums and informal settlements, where most guidelines to prevent transmission of COVID-19 are nearly impossible to implement. Moreover, people from vulnerable sections of society often make up a major section of the workforce of the urban basic services sector. For example, in India, women account for 50% of sanitation workers. Existing vulnerabilities, social discrimination, and poverty very likely also prevent such workers in seeking healthcare when they fall ill from COVID-19 or other diseases. In this context of the critical nature of services provided by basic services workers and their general marginal status in society, UN Habitat would like to offer some recommendations. And some of these recommendations are that all basic services workers should be equipped with adequate personal protective equipment based on the nature of their occupation. For instance, puncture-resistant gloves, face and eye protections, boots and overalls. Adjustments need to be made in the workplace environment. Easily accessible hand-washing facilities, adequate social distance between people, including co-workers and customers, and also physical barriers such as transparent screens between workers and customers. Work protocols should be reviewed and staggered. Work schedules with a view of minimizing contact between workers need to be considered. Adequate childcare facilities at safe distance from the workplace, particularly for female workers, must be provided. Facilities for preliminary screening, for instance, checking temperature, should be provided, and workers should be encouraged to report illnesses. But workers' rights and privacy should be respected, and workers should also be provided with adequate healthcare coverage. And when reliable testing, for instance, antibody testing, becomes available, it should be offered and made available at a low cost to workers. In the case of informal sector workers, providing food during the crisis will reduce their worry about having to provide for their families while they're at their jobs. In Chennai, in India, has demonstrated how this can be done for sanitation workers through the community-based Amma or mothers' canteens. Providing boarding facilities to sanitation workers, similar as being done for the health workers, could help protect their families or in case there is need to self-isolate. Governments at both national and local level must recognize the long-term public health and economic importance of protecting urban basic services workers. Many countries either are already implementing and considering stimulus packages. National and/or local government resources will be required to implement these measures I've outlined above. And government should therefore budget for these in their stimulus packages. This will protect workers and help ensure continuity of these essential services. Underlying these recommendations is the need to raise the profile of service workers, ensure that they're valued and recognized. They have to be paid just like we do for other health workers, and pay them their dues respect, acknowledging their importance as essential service providers. The crisis has given the world an opportunity to appreciate these essential contributions these workers make. As we endeavor to build back this world after this crisis, workers need to have a more central place, and we need to ensure they're protected from infection and the impacts of the pandemic. UN Habitat's Global Water Operators Partnership Alliance has been helping strengthen public water and sector sanitation utilities. And it recognizes that workers are the essential basis of these institutions and are intrinsic to their improvement. Providing better public services is not only just about finances.
1 minute to wrap up, Andre.
Yes, 1 second. And we're about to strengthen the human capacity in them. And in concluding, I would like to just pass on a message from the Executive Director, Maimouna Mohammed Sharif, that throughout this period, she has stressed the need for compassion and solidarity to tackle COVID-19 crisis, as well as the key role of local governments. She has particularly asked me to convey her appreciation once again to UCLG for this very lively and important webinar series. She looks forward to the actionable outcomes and recommendations from this event, and we at UN Habitat are committing to taking forward this in collaboration with UCLG and PSI. Thank you very much for your attention.
Thank you very much, and sorry for chasing you, but you know how these things are. Thank you for your important messages. One thing that comes to mind before giving the floor to Rosa Pavanelli, the Secretary General of PSI, is the difficult situation where we find ourselves when there is a lot of workers that are delivering public services, but are under subcontracts with other companies and not directly with the local and regional administration, and protecting the rights of those workers is very difficult. The other key issue, and I'm sure Rosa, you're going to cover this for us, is to make sure that both the workers and the local governments are included in the dialogue for the post-COVID. And judging from what is happening now, where in some countries they are talking about co-governance, it's going to be a very difficult task ahead. But I guess that needs to be our joint focus. Rosa, the floor is yours to set the scene from your perspective. Thank you very much.
Thank you very much, Emilia, and thank you very much, Andre, for your message and for giving us the opportunity to share this very important moment. I don't want to raise your deception, but I'm not going now to celebrate the important work that public service and mainly local government workers do every day, because I think that you recognized how important this role is. We are still trying in a Freudian way, try to elaborate this experience of confinement, this experience of a pandemic, and already preparing for the huge impact of the economic crisis that will follow the health crisis we are still in. And my point is actually looking at this part of the discourse. We have been also as trade union in the past 2 months as public service union much more focused on dealing with the protection, with the recognition of the fundamental rights of the health workers in hospital and in health services, because they have been the most exposed. And this is demonstrated by the fact that we have about 12% of professionals that have been infected, and many died because of the infection. But as both you, Andre, and you, Emilia, mentioned, there are so many sectors where public service workers have been on the front line. And I think that it was no fault of anyone, but we found all ourselves unprepared to deal with the protection of those workers, to deal with the protection of our communities, as the size of this pandemic was something unpredictable for all of us. I think that the post-COVID has to start from that point and to look how our communities, our alliance between workers and local government can help build a preparedness approach to our community, as all the scientists are advising us. We must be confronted next with the second wave of the pandemic, and nobody can exclude that some other kind of virus will break out at a certain point in history again. This is a lesson that we have to learn, and this is a lesson that has to do very much with the economic system we are we have been we got used to live in. We saw that the crisis, the scarcity of PPEs, is actually one demonstration of how weak is the system of the global value chain if it's not able to address the fundamental needs of a community when a pandemic such COVID happens. And it seems to me that the response of many governments and even local governments where there's not been an effective coordination at a national level responded trying to find manufacturing able to produce those equipment locally. This can be a way to support local business, local community, while helping stockpiling all the equipments that are needed and helping preparedness. I just want to mention that on this issue, but this is part also of the conversation that we had in preparation of this meeting, there is the opportunity to update and better use and adapt to all kinds of local government workers the guidelines for first responders and emergency workers that the tripartite expert meeting of the ILO elaborated just 2 years ago. This is a good tool that we can use and that can help and support us to guide our work in the future. No discussion that the issue of decent working condition, occupational health and safety, and decent wages is fundamental for all these workers. In public services or those providing public services. Emilia just raised the issue of outsourced workers. Well, I think that we can do a common work trying to ensure that occupational health and safety and decent working conditions are ensured to those workers as well, probably working together about conditions on public procurement and taking more responsibility as public administration and public government in guiding that process. I would like also not saying that will solve any problem, but as everybody are now predicting a terrible economic crisis that will be much worse than the 2008 crisis, that will probably endure 2, 3, or who knows how many years. Ensuring decent wages and helping local business is a way to support the economic fabric of our communities and helping to reconstitute a solid economic development in the post-COVID reconstruction. Of course, it won't be enough. I want to sympathize with mayors, with local government, because what I saw around the world, that they have been exposed to the highest level of pressure from citizens, for the population, while being squeezed or neglected by national governments and not always completely be on board in the decision-making process under a public health threat as the one we faced. So I want to sympathize with your role, but this also is calling on the fact that we probably need to be bolder, dare more in asking for a role for local government that can help the possibility to raise money through local taxation, that can help having local government being able to ask companies, corporates who are producing.
A few more seconds, Rosa.
Or producing on their territories and making profit out of there, to pay their fair share to the community. This is a global issue, but this has also to become a local issue. And I also think that we have been shaped in this idea that you can make money with money, and more frequently with virtual money, with transfer speculations. Well, it's time to go back to real work, to real wealth, which is the wealth of labor, and public service can help to support that development. That will crucial also to continue to work for sustainable development, and hope not to be forget that part of the work that we have been doing in the past years in the post-COVID recovery. Thank you very much.
Thank you so much. Thank you so much, Rosa. I think what we need to make sure is that you start also sharing and promoting the decalogue that the United Cities and local governments have put together, because many of the points that you have been picking up on are part of that decalogue, and the model on